Magnesium oxide, citrate, glycinate, L-threonate. With so many different types, how do you actually know which one to choose? Because the truth is, they don't all do the same thing. Today, I'm breaking them down simply so you can choose the one that actually matches your goals. Hello, I'm Dr. Elizabeth Miller, naturopathic doctor, and if you've ever stood in the supplement aisle feeling overwhelmed by all the magnesium options, this video is going to make that very clear for you. Just a disclaimer, this video is for educational purposes only and is not personalized medical advice, so always consult your healthcare provider before starting on any supplements. Before we jump in, a quick reminder from the last video, what matters most is elemental magnesium and the absorption rate. So different forms change how well it's absorbed, as well as how it reacts and feels in your body, and what symptoms it helps with. So choosing the right form actually matters. If you take nothing else from this video, start here. These are the 3 forms that I use most often in my practice. Number 1 is magnesium glycinate. This is my go-to baseline magnesium, so it's the best form for sleep, anxiety, and muscle tension. Magnesium glycinate, often known as bisglycinate, is magnesium bound to glycine, an amino acid that's generally calming and well tolerated. This is why glycinate is often the form I recommend for people who want magnesium for sleep, stress, muscle tension, or general nervous system support. The main advantage is that it tends to be gentler on the gut compared with forms like citrate or oxide. There's also evidence that because magnesium is attached to glycine, the body may absorb and transport it more efficiently throughout the digestive tract. This might help explain why magnesium glycinate is often easier on the stomach and less likely to cause diarrhea compared with some other forms. So if someone says, I want magnesium but I don't want loose stool, glycinate is usually where I would start. The next form is magnesium citrate. This one's best for constipation as well as general use. Magnesium citrate is magnesium bound to citric acid. This form is generally better absorbed than magnesium oxide, but it also has a more noticeable effect on the bowels than glycinate. Magnesium salts like citrate can act osmotically, meaning they draw water into the intestines, which can soften stool and stimulate bowel movements. So citrate is often a good choice when someone wants magnesium support, but also tends towards constipation. Despite the fact that it does have a stronger GI effect, magnesium citrate still has other beneficial systemic effects similar to magnesium glycinate. But if somebody already has loose stool, IBS-D, urgency, sensitive digestion, citrate might be just too stimulating. The next one is magnesium L-threonate. This one is good for brain health, focus, and cognition. So L-threonate is magnesium bound to threonic acid, a metabolite of vitamin C. This form became popular because animal research suggests it may raise magnesium levels in the brain more effectively than some other forms. That's why it's often marketed for memory, cognition, focus, and brain health. Human studies are still emerging, but some human trials reported improvements in cognition, memory, sleep quality, mood, and alertness. The important nuance is that magnesium L-threonate is not necessarily the best choice if your main goal is correcting a whole body magnesium deficit, muscle cramps, or constipation. It usually provides a lower amount of elemental magnesium compared to glycinate or citrate. So I like to think of threonate more as a brain-targeted magnesium, not the best all-purpose magnesium. So you might need to take this in addition to glycinate or citrate. Here's the next tier of different forms of magnesium that might be helpful depending on your goal. The next one is magnesium malate. This one's best for fatigue, low energy, and muscle soreness. This form is magnesium bound to malic acid, which plays a role in cellular energy production. Malic acid is involved in one of the main pathways your body uses to generate ATP, also known as our cellular energy format. So generally, this form is considered to have good bioavailability and is often well tolerated. So because of this, magnesium malate is sometimes used in people with low energy, exercise recovery issues, muscle tension or soreness, and chronic pain syndromes like fibromyalgia. Compared to citrate, it's usually less likely to cause loose stools, although higher doses still can in some people. It's not necessarily stimulating like caffeine, but some people do report feeling more energized on this form, so I usually prefer earlier in the day rather than right before bed. The next one is magnesium taurate. This one is best for cardiovascular support, it's calming, and helps relax palpitations of the heart. Magnesium is bound to taurine in this form, so it's an amino acid involved in the nervous system and cardiovascular function. It's generally thought to have good absorption and tolerability, and taurine itself may help support nervous system regulation, heart rhythm stability, and blood pressure balance. So this form is often discussed in relation to palpitations, stress-related cardiovascular symptoms, blood pressure support, and nervous system calming. It also tends to be gentler on the digestion and is less likely to cause diarrhea compared to citrate or oxide. The main downside is that it usually contains a lower amount of elemental magnesium, so people need to take more capsules to reach therapeutic doses. And the next one is magnesium orotate. This one is a bit niche for cardiovascular support, and it's basically magnesium bound to orotic acid. It has moderate bioavailability, though it's less studied than glycinate or citrate. This form gained attention because some early research suggested potential benefits in heart health and cellular energy support, particularly in the cardiac tissue. You'll sometimes see it marketed towards endurance athletes, cardiovascular health, and energy production. However, the evidence base is still fairly limited compared with some of the other more established magnesium forms. It also tends to be a little bit more expensive. So when it's an interesting format, it usually isn't my first line recommendation for the average person, unless there's a very specific reason to use it. Now, here are some of the lower quality situational forms of magnesium. The next one's magnesium oxide. So this one is very common, but it's not ideal. It has a high elemental magnesium percentage, about 60%, but it's a poor absorption and causes a lot of GI upset. So this is why you'll probably find it in more cheaper supplements. The next one's magnesium carbonate, which is often used in powders. So this converts to magnesium chloride in the stomach, which can neutralize stomach acid and can be helpful for acid reflux. So it has a bit of a moderate absorption, but it's not a top choice compared to the other forms. Next one's magnesium hydroxide, which is found in products like milk of magnesia. So this one's primarily just used as a laxative because it has a very strong osmotic effect, pulling water into the intestines. So it's more likely to cause urgent diarrhea or cramping, so it's less ideal for daily long-term use or solely used for magnesium replacement. How this one compares to magnesium citrate is a little different. So magnesium citrate also can loosen the stools and has osmotic properties too, but citrate is generally better absorbed, it's a bit gentler, and it's more commonly used as a daily magnesium supplement versus this format. The next one is magnesium sulfate. So think Epsom salt baths. Mostly this one's found topically or in bath salts. Magnesium sulfate can have some muscle relaxing effects when used topically, such as in creams or Epsom salt baths, but it won't have a significant full body effect when used topically. It's not commonly used orally as well, just because it's not usually well tolerated. And the next one is magnesium lactate. So this one has a decent absorption and it's gentle on digestion, but it's not thought to be as popular or well studied as glycinate or citrate. It's generally better absorbed than oxide, so it could be a reasonable option if you can find access to this one. So if you want to take a minute and pause this video and screenshot this chart, here are the approximate elemental magnesium percentages for the major magnesium forms. These numbers can vary slightly depending on the exact compound and manufacturer, but these are good general ranges for educational purposes. And if you'd like more info to refer back to in an easy printable handout, we have a PDF linked below this video with a similar chart with extra details on magnesium dosing, timing, and a label reading checklist. So instead of memorizing all of that, here's how I want you to think about it. For most people, start with glycinate. If constipation's an issue, use citrate. And if brain support is your goal, consider L-threonate. Everything else is a little more situation specific. In general, absorption tends to follow this pattern. The highest absorbers are glycinate, citrate, and threonate. Moderate would be malate, taurate, and lactate. And the lower absorption options would be oxide and hydroxide. But remember, absorption isn't everything. It's about absorption, dose, and your symptoms. One of the biggest mistakes I see is people choosing a good form, but not taking enough elemental magnesium to actually feel anything. So you need both the right form and the right dose. So if you missed it, check out episode 4 where I break down elemental magnesium in detail. So if you're feeling overwhelmed, just keep it simple. Pick a form that matches your goal, make sure you're getting enough elemental magnesium, and adjust based on how your body responds. If you want help choosing the right magnesium for you, we put together a magnesium selection guide that breaks this down even more simply. It includes dosing, forms, and exactly what to look for in a label. You can download that below. And if this video helped you, make sure you're subscribed because in the next video, I'm going to tell you why magnesium glycinate is one of my favorite options for sleep and stress.